So what do you think the future of shoulder surgery, and kind of how does that go along with the future of medicine? Do you think we're going to be doing the same thing for 2 years, for 10 years? Or do you think things will kind of shift? And if so, how do you think that shift's going to come?
Well, I think a lot of the new stuff is going to become with technology and AI and adaptive AI. But like Dr. Satella said today in his presidential speech, is the machines are great, but we are far smarter than the machines because they only get the data from us, right? So pretty much what I took from that was don't become a monkey with a wrench and just do the same thing over and over. Push yourself to learn and to do research, because that'll keep us at the forefront. But then also the learning AI algorithms models will become that much better, and then patient outcomes will be better. So I think that's going to be the biggest change within the next probably five years. Is AI is really going to be involved with medicine. I mean, you look at these post-operative not protocols, but just platforms like My Mobility, where the surgeons can get like real-time data on patients with range of motion, or if they had a fall or something.
Right. After joint replacement, right?
Exactly. Mm-hmm. So I think it's going to really take off in the next 5 years. We'll still be taking care of fractures and doing arthroplasty and rotator cuff repairs, all the soft tissue things. I definitely think we have definite job security for the lifetime of our orthopedic career, for sure.
Our minds are important.
Yes.
As surgeons.
Yeah.
You didn't think about that when you're younger. You're like, oh, surgeons, they just operate. No,
Yeah.
It's like you got to be pretty sharp. And we're the ones that understand the shoulder
100%,
the most.
Right. Which is crazy. One of the fellow before me when I was at Penn, he when I came out, I was talking with him, and he says,
Who do you remember?
Josh Rogozinski.
Oh yeah, I remember Josh.
So he says you're the shoulder guy now. Like you're the smartest shoulder person in your area, so you're the go-to guy. And coming out, I was like, I mean, okay, sure, whatever you say. But then like you really are.
It's true.
And then I mean, sure, you're just growing confidence in those first couple of years, but it's very true. Like that, and that's why these fellowships and coming to these meetings and then taking back what we learned in the community, because we are the shoulder people, the gurus.
Totally. And I want to spread that knowledge. I think what the foundation, the ASCS Foundation, is doing is really good to really spread the concept of shoulder specialists to the younger generation, medical students. And really the only reason I went into shoulders is I had a good mentor who was like exceptional. Nobody else understood what he understood. I'm like, that guy's the wizard. Reza, Reza.
I know Reza really well. Yeah.
But yeah, he's just, and he was highly influenced by Itamura and other specialists. So, and they were influenced by guys like, Mattson and all the old timers, the original guys, the OGs.
Yeah, exactly. Yeah. Question for you.
Yeah.
How do you,
I'll accept one question on the show. One question.
Especially being in private practice, how do you differentiate yourself in the public's eye from being a shoulder elbow surgeon from a sports surgeon?
Oh, in the public's eye.
Yeah.
I think that's a really good question, because what people want to know is how things are going to go. And if you are somebody who can treat the anatomy and the pathoanatomy from start to finish, then you're kind of an expert in managing them. Sometimes I want patients to go see a spine surgeon so they can not have surgery, or they can at least have a full assessment, and then they see the guy who says, I don't think I should cut on you, and then they feel much better, and maybe their neck pain gets better, but they have this degenerative problem, but at least they know now from the guy who can tell you whether or not we should be cutting, because you should listen to that guy. Right. And I'm that guy, for the shoulder. You're that guy for the shoulder and elbow. And I think there's a mixture of training in sports, because sports that type of training is based on sports injuries. And if you injure your knee during a game, then you see the sports surgeon. And if you injure your finger, he's got to figure out if he knows how to pin things or if he should send you to a hand surgeon.